Ola Lahui's mission is to provide culturally minded, evidence-based behavioral health services that are responsive to the needs of medically underserved, Native Hawaiian, and rural communities. And what that really means is that we want to provide excellent care to the people that need it the most. So instead of thinking as our rural and underserved communities as the places that get the last of everything, that we give them our very best.
Well, when I first walked in, I came in alone. They made me feel very comfortable. The first person you meet is Jerry, and she makes you feel that you've come to her house to have potluck.
They're very friendly and easy to talk to, and they have a lot of information and education for you to learn about nutrition.
The guiding philosophy of Ola Lahui is to find individuals with a heart to serve and to place them in rural communities where they can begin to grow their roots, and to give them the skills and competencies that they need to sustain the work.
So I've been with Ola for 2 years now. My first year was as a predoctoral intern. I did 2 days a week on Molokai and 1 day a week here at the Ola office. And this past year I actually was on island, but I traveled from Kahuku to town and also to the leeward side.
When I got the internship and went out there into the communities, you know, up on Molokai and in Waimanalo, and you just really put faces to names, and you really see the families and the challenges that they're having with access to care, you know, waiting months, you know, just to be able to see a psychologist. And you see them suffering for that time frame, you know, it really stuck with me, you know, and so that's one of the reasons why I decided to stay on for postdoctoral fellowship and have been a part of Ola Lahui ever since, you know, training those next wave of you know, psychologists, you know, in this mission and helping them provide culturally mindful behavioral health services.
We have had about 38 trainees come through our program, and of those, 26 are now licensed psychologists. 92% of them continue to serve in medically underserved areas.
Being able to explore with the faculty at Ola Lahui, you know, my passion, my commitment to vulnerable communities, that still drives my practice today. You know, I always have, you know, that those messages in the back of my mind that we're there to serve the community and provide quality behavioral health services to folks, regardless of their ability to pay.
One of the biggest keys that I've learned from Ola is that I have a voice. As a Native Hawaiian, I have a voice, and that's something where I don't think I've ever had before. I've tapped into that, but knowing that I can make changes, not only personally, but systematically in the community.
They have this hand that's out there that says, come, let me help you. So anybody in the community at any parts of the island or outer islands can just pick up a phone, ask them questions, ask them what this organization can do for them. So they're there for you. You just need to pick the phone and call them, if anything.
You know, they help the community in need. They help rural underserved communities. And like my mentors who actually run the program there are not only the mentors there, but they actually get into the community and work themselves. So they do everything that they expect all of us to do. So it's a program that works, and I think they believed in a niche, and it's no longer a niche, it's something that it should be implemented in every rural community, because it does work. I've seen people's lives change because of it.
Instead of being a couch potato and just sitting at home, I'm more active. I think it's given me a little more energy to do more things. I'd like to think that I'm being proactive in my health care. So they've done a world of good for me.
Well, thanks a lot for everything, and yeah, you guys doing an awesome job, and keep it up.
We all share, we learn from each other as well as from our instructor. It's just a whole bunch of stuff that you can take with you, you can share. either here or when you go out. I tell people about this organization all the time because I think it's wonderful.
I have a lot of respect for people that live in the rural communities, because basically what I talk about is that our people, Native Hawaiians, our people, our Lahui, has been in a state of crisis for centuries. If you're talking about healthcare and health needs, there's a very clear path that you can trace through history about the decline of our health went along with the change of our economic and all of our social systems. When all of that changed, our health went right down. Diet changed, physical activity changed, and really on our insides, we no longer had this clear way of understanding what we were meant to do, what was our good work. And I think that really affected us in a profound way. And so out there in those communities, they've learned how to be resilient and how to take care of yourself without the formal structures around it. The thing is that's really hard to do when you have modern pressures, modern diet, modern illness around you. What used to hurt our Lahui, what killed our people in the first wave of things, was infectious disease, right? Was illness that was brought from others, the sailors. What's killing us now? Chronic conditions, things we can prevent, things we're doing to ourselves, the way we live. The modern lifestyle is killing us. And so knowing that out there they figure out and make do, you have to have a lot of respect when you come to that community and say, I want to help. Here's my two hands, I will give you what I have. Here's what I'm trained to do. Can I help? How do I help? And let them tell you what to do to help. Because the other thing about our work, and the thing we had commitment to from the beginning, was we were always going to plan for the long term. We weren't going to be someone who would come, give, set up a new program that everybody likes, and then go, oh, sorry, the funding left, and walk away. So when we plan services and programs, we're talking from the beginning about how to keep them going no matter what the funding circumstance. And that's something that really matters to community. I think it's something they've come to be able to count on us for, is if it's an Ola Lahui program, it's going to be there next year. It's not going to be fly by night, and it's certainly not going to be where we come, we take from them and what they know and use their poor data to get funding and leave without giving them anything. We're all about being there for what they need. We figure out how to fund it. We figure out how to be there. And we're not going to show up until we know that we can take care of it in the long run. Now, that can be hard to do. Funding-wise, that can be really tricky. But what we've always been really committed to is that if we stay mission-driven, if we keep working toward our mission, we don't chase money, we don't chase fake false partners. We focus on the work that we do. We're clear and communicate about what we can do, and we find other people that recognize this need, and that's how we keep it going. We understand that we have to be nimble, so we don't have a big staff. We don't have big old, huge, fancy offices that we've been in for a million years. We keep it nimble, we keep it streamlined, because we have to be able to react and respond to what the community needs. And we know that being a nonprofit's not easy. It's not. But it's the right way to be, to say that our work is centrally focused on moving toward our mission. And when we stay focused on that, we never go wrong. The funding comes when it's supposed to. The person or the partnership comes into our world right at the moment it's meant to. I've always believed that for Ola Lahui, that things happen at exactly the right reason at exactly the right time. And being guided by Na'au and being guided by our mission to continue to do that good work. Know what you're good at, keep doing that, seems to be the way that we've been around for 10 years. And I think it's the way that we're going to be around for a lot more years after that.